I'm Dr. William O'Connor, and it's now December 30th of 2013.
Yeah.
Back as far as at least June of 2012, we were treating you for your neck pain.
Right.
Now, you had at that time, at the C5-6 level, an MRI showing even some osteophytic ridging that was encroaching on the ventral epidural space,
Right.
but there was no significant central spinal stenosis. And bilaterally, you had some neural foraminal stenosis due to uncovertebral joint hypertrophy, which was slightly greater on the right. The other discs were pretty much normal, and there was degenerative changes seen at the C5-6 level. But the main thing was you had severe unremittent neck pain. Can I, without putting too much words in your mouth, ask you to give me like a before the technique I taught you, which was the O'Connor technique, and
Right.
after the technique, what your experience was and your pain levels before and after, and how the O'Connor technique helped you?
My neck pain, back neck pain level has pretty much gone away. Yeah.
What was it before?
I've had frequent discomfort prior to that. I guess you could call it pain, discomfort. And I haven't had much of any issue with it anymore.
And do you attribute that to the technique and
Yes.
the understanding of the mechanics that are taught in that technique?
Yes.
Were you convinced at the time, I believe I did manipulate your neck or taught you how to manipulate your neck? Was the pain that you were experiencing almost instantly relieved with the manipulation, and then it came back, but then you were educated on how to self-manipulate your neck, and when you get the pain, are you convinced that you're able to take yourself out by inducing a mechanical change to your neck?
Well, it's been so good I haven't really had to even use it anymore. It worked. And yes, I would try it again if I had the problem again.
But there's no doubt in your mind that the technique is what took away the pain.
Correct.
Now, you had pain going down your arms, didn't you?
I did. And that's also gone away.
And that was both arms or just one arm?
One arm.
And that pain was aggravated by flexion while you were weight bearing, where your neck was bent forward and you were bearing weight on your discs and bulging your discs posteriorly. Part of the technique taught you how to manage that. Do you attribute the understanding of the mechanics and how to prevent the neck pain as part of the reason why to this day or now, we're a year later, you don't have any pain?
Yeah, the methods have taught me how to solve the problem, A, and B, the other things in your great book have also taught, and what you taught me as well in person, have taught me how to avoid having any serious spinal pain. And I have not had any major spinal issues at all since. I have to be careful, of course. And I saw certain things or felt certain things that were possibly coming on, and I avoided anything getting worse by taking account what I learned from you.
Now, I'm looking back through your chart and seeing on January 19th of 2012, 1 week ago while in flexion had severe pain in the right lumbar back, had shooting pain down to left foot and numbness on left, but that resolved after 3 days. Took something from an orthopedist for 6 days. Steroids. You would use steroids from an orthopedist. I had diagnosed you as having a disc herniation in the low lumbar region more to the left. I then took you into my room. No, I didn't. I taught you
Yeah.
the
Methods.
techniques
Right.
and what was causing that pain and taught you how to get out of the pain.
Yeah.
I spent 40 minutes describing the technique, and I taught you the technique in one visit, and by the next visit, March was a month later, you had completely gotten better. You restored your full range of motion to your lumbar spine, and it had been you had fixed your lumbar spine as well as your neck, right?
I don't remember the specific dates, but yeah, I'm fine now. It's all good. And I highly recommend using your services again. You're a fantastic doctor. Brilliant. You spend time with your patients. I'm very lucky to have you.
Now let's go back to your neck thing again. That was
Right.
in 2012.
I recommend you to my friends too. Also my out of town friends. I've gone to the doctors and they've not been anywhere nearly as good as you are, Doctor.
All right, let's see where the neck issue came in and what we did, because I know we refilled that. In reviewing your chart back in March of 2012, I note that you had been definitely helped with the dynamic positioning after a few days. Now that's a concept that is covered in both my book and my website. You went to my website and read the website.
I went to the website and
Do you also have my book?
I bought your book?
Yes.
Absolutely.
Okay.
And I have it right next to me in my bed, on my bookshelf in my bed.
Saturday had numbness in upper right arm to thumb, and when getting out of bed, a crepital sound occurred and the pain resolved. Now the pain has recurred, but not definitely numbness. At that time, I diagnosed you as having a disc herniation to the right at the low cervical, and we moved through a mild maneuver, but it was very uncertain as to whether it went in on the first trip. And I then brought you back the next week for a more extensive visit. And my chart indicates that on or around June of that year, 2012, that I taught you how to perform a cervical neck maneuver, and I also showed how the numbness down your hand was actually originating in your spine,
Right.
and we identified that you had a radiculopathy, that the nerve root was actually being impinged upon by a piece of disc material, that with the proper positioning and teaching you how to do the maneuvers on your neck, over the subsequent months, my chart shows that your pain resolved.
Yes.
What you thought was a carpal tunnel on your right, I believe, turned out to be really your neck. And when you learned how to properly manage the neck problem, the arm symptoms resolved. Is that correct?
That's pretty much how I recall it, yeah.
You have no arm symptoms now,
No.
and your neck is no longer painful, is it?
Correct.
And do you attribute that to the understandings that you acquired through the O'Connor technique? Is
Correct.
that?
Yeah, the O'Connor techniques are good. They work.
And,
So
and
good that I don't have to, I'm not worried about it now.
do you think it was just luck? Because a lot of people think their neck is different and your neck is your neck and it fixed your neck.
I
But
do not think it's luck because the timing of, I had the issue, I used the O'Connor technique, and then the problem went away.
and how long had you been plagued by that problem prior to that? How long had you had neck pain? Do you recall?
I don't remember how many years, but it's been quite a few years.
It was on the order of years.
Yes.
And what typically I see is people get neck pain and they don't have any idea of why their neck hurts or why their arm hurts. Part of my technique is to educate people as to the mechanics and the source of the pain.
Right.
Did your understanding of the source of the pain make you less anxious about that pain and less nervous about perhaps becoming
Correct.
paralyzed or
Correct.
or losing the use of your arms or whatnot?
Correct.
In that context, then, just the understandings which are articulated in my literature
Right.
are capable of relieving the stress
Yeah.
and the pain
Yeah.
additional that people get
Correct.
when they don't know what's causing their pain and have no
Right.
idea how to control it or how to manage it.
Right.
Did you find that now that your neck is not an issue, that your whole kind of attitude, like your back and your neck, are not worrying you as much? Do you
Correct.
find that now you have taken control of that and can in some way manage it much better than you had prior?
Yes, now that I understand what it is that caused the problem and how the O'Connor technique worked, then my fear levels went down and I feel much better. That's simple.
Do you think this would apply to most people who have these
course.
problems? Now,
course.
certainly you're not a doctor, but
Yes.
I'm certain that your understanding of this is what made it better, and
Yes.
it's because I applied what works on most other people to you is
Right.
why you got better.
Yeah. Yes.
Okay, that's good. Yeah, good,
Are we off of the-
good dog.
Down. She's not supposed to. Down.